more on healthcare now, we're joined by Martin Rosen, the founder of Health Advocate, an independent advocacy and assistance company. He's also a former Aetna U.S. healthcare executive and the author of the Healthcare Survival Guide. Mr. Rosen, welcome to Bloomberg News.
Thanks a lot, Mark, for having me.
Sir, one of the things that jumped out at me was a chapter that discusses COBRA, and that is the healthcare plan for folks who do not have regular company-sponsored, company-mandated health insurance. COBRA only lasts for so long. If someone's COBRA runs out, do they have any options after that?
They do, but let me first comment on the COBRA. Basically, what COBRA is a provision allowing for people who are terminated from their work to continue on for up to 18 months, and in some cases a little bit longer, to continue to have health coverage that they pay for. One of the things that I would highlight is Congress passed back in February an enhancement to COBRA, which actually allows for the federal government to pay up to 65% of the cost of COBRA. That's sunsets on 12/31 of this year. There's some discussion that it might be enhanced going forward. But the reason I mention that is that for individuals who've lost their job recently, they should definitely see if they qualify for the enhanced COBRA, where the federal government would pick up that cost.
You also advise folks that they can't comparison shop for private insurance. Is this something that's widely known?
I think a lot of the things we covered, Mark, in our book actually are not widely known, and they absolutely should look at the book. It's for free on our website. We'll mention that in a moment. But there is a lot of benefit to comparison shopping because the costs vary very, very widely. And what I think we found is that people should really look at those provisions of the various policies and then determine what they really need. Don't overinsure, because you'll pay a lot more in the premium. You might get benefits you really don't need, certainly in the short run.
And it doesn't hurt to ask a doctor for a discount. The worst that can happen, they can say no.
Absolutely. What we found in our research is 61% of the people who asked a physician for a discount actually got it. And that's a remarkable number. Just asking, obviously doing it in an appropriate, respectful way. And not only a doctor, a hospital and other healthcare provider. We're living in extraordinary, unprecedented economic times, and I think most healthcare providers will try to make an accommodation if possible.
Mr. Rosen, do you think healthcare reform is going to pass?
Well, I'll leave that to the members of the Congress and the Senate. My sense is something will happen. I'm not exactly sure, the various provisions. Clearly, anything that's going to help deal with the cost issue or the access issue is important.
And Mr. Rosen, can we get the website? I know you wanted to get that in.
Yes. Go to www.healthcaresurvivalguide.com. That's www.healthcaresurvivalguide.com. Visitors could go there, get it for free, and also come back because we're going to be providing important updates on a regular basis.
Martin Rosen joining us, former Aetna U.S. healthcare executive, the author of the Healthcare Survival Guide. Mr. Rosen, hopefully we can have you back and talk about this a little bit further. Thank you so much.
Thank you very much.